The broadcast is now starting. All attendees are in listen-only mode.
Good evening and welcome to Repo Action's Act and Learn webinar for May 2019. We're incredibly excited and proud to present tonight's webinar. The topic is healthcare discrimination and disparities faced by the LGBTQ community. So first, to kick us off, let's introduce your host. The first voice you're hearing is Erin Matson. I use she, her pronouns. I'm based in Arlington, Virginia. I'm Erin to the Max on Twitter. And I am one of the co-founders and co-directors of Repo Action.
I am the other co-founder and co-director of Repo Action. My name is Pamela Merritt. My pronouns are she, her. I'm based in St. Louis, Missouri, and I'm at Sharkfu on Twitter.
All right, so let's do a quick spin through the agenda. We're going to introduce Repro Action, and then we'll have Cara will lead a conversation on why a conversation about healthcare discrimination against LGBTQ folks is important, and creating healthcare spaces that are inclusive of LGBTQ folks. And then we'll move into our panel discussion. It's going to be fabulous. We have Ethan Winters, who's a trans and queer activist, Oliver Hall, who's a trans health director at Kentucky Health Justice Network, and Bridget Schaaff, who is the If, When, How Reproductive Justice Federal Policy Fellow at the National LGBTQ Task Force. We'll do next steps and then Q&A. And I want to encourage two things. One, if you have any questions at any point during this webinar, whether that's questions for Cara based on their presentation or questions for any of our panelists, just put them in the chat box, and Pamela will moderate a Q&A at the end, and we'll get to as many questions as we can. So you don't have to wait until the end to type in your questions. The second piece is I want to encourage you, if you are on Twitter and like to tweet along, just use the hashtag Reproaction. So who is Repro Action? We lead bold, direct action to increase access to abortion and advance reproductive justice. We're deeply proud of our left flank analysis. We have a willingness to hold folks on all sides accountable, whether they're traditionally considered allies or opposition of abortion, access, and reproductive justice. And we have a deep commitment to nonviolent direct action as one of the tools in our toolbox. And with that, I'm very pleased to introduce Cara Mailman, who is our campaign coordinator for Repro Action. Cara is based in Arlington, Virginia, the great county of Arlington, Virginia, and is Cara Mailman on Twitter using they, them pronouns. Cara, thank you so much for all your work to pull together this fantastic webinar.
Of course, it is my absolute pleasure. I'm super excited to be here. I'm going to keep this fairly short so that we have plenty of time to hear from our excellent panelists. Erin, could you please go to the next slide? Thank you. So I just want to start by briefly talking about why a conversation about healthcare discrimination against LGBTQ folks is so important. And the baseline reason is because not enough people are having this conversation. Right now, this is largely a conversation being held within the LGBTQ community, which is good. But if we had the help of our allies, if we had the help of people who work in social justice and reproductive justice, if those people began having those conversations with us, we could make changes to this flawed system faster. We could make our voices heard more easily, and we could create progress more efficiently. So baseline reason we need to have conversations like this is so that other people start having them too. Another reason is to promote the key principles of reproductive justice that we here at Repro Action stand for. Specifically pulling out issues of gender equity, not just for cisgendered and binary gendered people, but for people of all genders, and to promote bodily autonomy so that LGBTQ people feel comfortable in their ability to control their health and their lives and actually take part in our healthcare system without fear of harassment. And finally, we need to have these conversations because LGBTQ people and their health are genuinely suffering. According to the 2015 US Transgender Survey, 33% of trans people surveyed said that they had experienced direct discrimination during a healthcare visit, whether that be verbal harassment or being refused care by their healthcare provider. And 23% said that they had chosen not to seek healthcare when they needed it because they were so afraid of being discriminated against or harassed that they preferred to put off necessary care than go through the struggle of potentially being discriminated against and putting themselves in that extremely difficult and very vulnerable situation, which is unbearable. If you could move to the next slide, please. Thank you. And now I just want to give a quick overview of some ways that we can create healthcare spaces that are inclusive of LGBTQ folks. This is not comprehensive by any means. I am not an expert, but these are some things that can be done. Making spaces and materials that are gender and sexuality inclusive. This includes things like intake paperwork. If your intake paperwork asks people to identify their gender or their sexuality, and you're only including 2 genders, that's not inclusive. As a non-binary person, having an intake form that forces me to pick a gender that I'm not is really uncomfortable, and it signals to me that staff isn't going to respect my gender identity and puts me in a position where I either have to disclose verbally or I just have to be misgendered for the entire appointment, and neither of those are preferable. Things like brochures, if you have materials that you give out to patients, making sure that they are geared to more than just cisgendered people or heterosexual people, making sure that your materials are comprehensive and aren't alienating the people that they're supposed to be helping. This next one, gender inclusive restrooms, should be easy because most healthcare facilities have single stall restrooms, but unfortunately there are definitely still places that have gendered single stall restrooms in their healthcare facilities, which seems counterintuitive, and this is an easy fix that can make patients feel more comfortable. And then this last one is applicable to all healthcare, but I think is especially important for reproductive healthcare, because I think that in general, reproductive healthcare providers are more likely to use their social media than your average dentist. So making sure that anything you're putting out on social media, any ads that you have, is focused on the care of, is focused on everyone that could be receiving that care and not just cisgendered women who need reproductive health care. Those aren't the only people that are going to come into a healthcare clinic on any given day, and only directing your outreach to them puts LGBTQ people in a very uncomfortable position and can signal that maybe that isn't a healthcare provider that's going to be inclusive of us, to understand our issues, and be able to work with us in a compassionate way. Next, healthcare providers can give trainings and resources to physicians and staff, and this doesn't just mean doctors, this means anyone working in a healthcare environment can and should be getting some kind of training on just basics of LGBTQ identities. Giving this training to healthcare providers and their staff can ensure that they know how to talk with at least some knowledge about LGBTQ identities, and ensure that the patients they're talking to feel respected and secure, because not all discrimination by healthcare providers is done out of malice. Some of it is done out of just genuine ignorance of the issue. I have heard healthcare providers who are firmly in support of making sure that trans people need care, talk about trans people in a way that's not accurate and use words like transgenders, not because they intend to be unkind, but because no one has ever told them that that's wrong. And these are the kinds of small things, or at least things that seem small to some of us, that can make a huge difference for an LGBTQ person who is coming in for a healthcare visit. Another thing that providers can do is create an emphasis on informed consent, which basically just means that doctors should be taking the time to explain what they're doing and why to their patients, and making sure that their patients consent to that form of care, especially for people who have endured trauma. This is extremely important because there may be some particular actions or some particular aspect of the care you're describing to them that could trigger some past trauma, or for trans people trigger some gender dysphoria, and could make them feel deeply uncomfortable and put them in a state of psychological distress. And that is the last thing that healthcare providers should want to do to their patients. And so talking with patients, understanding what their triggers are, understanding what good care is going to look like for them, and when possible, adjusting care or making concessions to help make sure that they are comfortable. And this can be something as simple as letting their partner come into the room with them and stay with them, or having another person, even just another staff member in the room if, for example, the doctor is male and the patient has some trauma regarding men and doesn't want to be left alone one-on-one. These things happen, and it's important that doctors are aware of these kinds of traumas and act with compassion. I've linked at the bottom 2 resources that I think could be very important for healthcare providers going forward, and also for activists who want to learn more. The first one is Spark's Trans Leadership Initiative Digital Library, which gives an overview of different kinds of discrimination that LGBTQ people can face in the healthcare system. And this last one is specifically for reproductive health, but there are parts of it that are useful for all healthcare scenarios, and it's the Queering Reproductive Justice Toolkit from the National LGBTQ Task Force. My favorite thing about this toolkit is that it starts off with a glossary of terms, including a lot of LGBTQ identities, which again, I think is extremely important for providing compassionate, informed care to LGBTQ folks, is understanding, or at least knowing a little bit about the different identities that LGBTQ people have. And with that, I am very excited to introduce our first panelist. So Ethan Winters is a trans and queer activist located in Georgia. Throughout his transition, a lack of trans representation created a drive that brought him to his passion, which is public speaking. His passion and personal experience come together to humanize the trans and queer experience. Ethan, thank you so much for being with us tonight. Ethan, are you there?
Okay, can y'all hear me now?
Yes, perfect.
Okay, awesome, fantastic, thank you.
Yeah, of course. So my first question for you is, how have these healthcare disparities impacted you and your community, and how have you worked to combat them?
For me personally, when I came out, I was in college and in Georgia, which, you know, Georgia. And so they didn't have the resources or even the knowledge that like queer and trans people were on campus. Somehow they thought that they didn't see any queer people at all in a day. I don't really understand how they thought that, but That's how that went. And it kind of made me, I was upset about it, and it wasn't even about me that I was upset. It was like everybody else. It was like, how are my friends supposed to go and, get the access to healthcare that they need when the one space that we have on campus that we're supposed to be getting these things doesn't even think that, we exist. And so with that, it kind of made me want to have those really hard conversations with healthcare professionals that were on our campus. And I was like, well, if it's not going to be here, then we're going to make it. So I went and I emailed the director of our health services at my campus, and I was like, hey, can we like just sit down and have a conversation about, X, Y, and Z, about LGBT stuff and access at health services? And he was like, yeah, sure. And so I went in there, and for about a semester and a half, we had meetings every other week to talk about what could be done on our campus. And there was literally a time when he told me, he was like, I really don't think that we see queer people every day on this campus in health services. And I was like, oh, I guarantee you that we are here every single day, and you're making us feel uncomfortable because you're not giving us the kind of care that we need.
I cannot imagine how difficult that must have been, especially because, as I am also from Georgia, I know that it's not, especially depending on where you live, not the most LGBT friendly place to be.
Not at all. Literally
No.
where I'm at, it's like we're in the middle of cotton fields, like surrounded on all four sides.
Oh,
We're
no.
in the backwoods somewhere. And they were just literally like, we don't think we see y'all. We don't know how to help y'all. So it was literally having to go in there and have these conversations and be like, hey, this is what we need. This is what we need to talk about. There are trans men, there are trans women, there are non-binary people, there are lesbian, there are gay men, there are all these things on campus walking around, and they need, healthcare just like anybody else for varieties of reasons. And like literally, I think the only thing we had when I first started having those conversations with them is like we had free HIV testing on campus that went through the campus's GSA, and it was like the only thing that the queer community was linked to was HIV testing. And it was like, there's so much more that we need than that.
So that actually builds in to my next question, which is, based on your experience, what are some steps that healthcare providers can take to ensure that their LGBTQ patients feel safe and respected and like they're getting the care they need and deserve?
I think one big thing is, do not treat us like we're all sick. Like there have been so many times when having conversations with like healthcare providers that like, they're like, oh, well, we have free STD testing and HIV testing and stuff like that. And I'm like, that's cool, that's great. But do you have providers that can give me my hormones, that can check me for other things, that can make me feel comfortable going for like yearly checkups and stuff to make sure everything in my body is functioning the way that it's supposed to? Like, can you do those things and make me still feel like a human and not like subhuman to that? So I think one big thing was just like, and I don't think it's malicious at all. I think it's like you were talking about earlier, it's ignorance, and they don't realize that, how they were taught or the world that they think we're all living in just isn't that. And I don't feel like we're still in the time when the only thing about the LGBT community is like HIV, which, is still a big issue, and that's great that you're giving free testing, but like give free testing to everybody. Don't just like single out the queer community and be like, here, y'all need this, and that's like the only thing we get. And so I feel like that's one big thing. Making us feel human is a really big thing. If you don't know, ask. and ask in a respectful way. I think having open-ended questions like intake information where I can like put my information and it feels like it's not going to be like discriminated against, because like you said earlier, it's really hard to have those conversations and like disclose who you are when you're in a space that feels like, you know, you're barred into these boxes. And I feel like it's really important to have those conversations. And I get that there's, you know, there's those quote unquote biological things that like, you know, doctors need to know about and stuff like that. But there's a way to ask those questions and to get those kind of answers without making me feel like less than human, like making me feel like just like a bag of parts is not what I want, and that's not comfortable for me. Like there have been times where I've personally like not gone to doctors when I needed to, just because I didn't feel comfortable. I didn't feel like what I was going to go there for was what we were going to talk about. There have been times when nurses have asked me questions that like were not like it was a question that I guess medically you might need to know, but it wasn't asked in a way that made me feel like every other student walking around on campus. And I also think, especially from personal experience living in Georgia, it's really important to like not always send students elsewhere and like be like, oh well, we can't do that for you, we're going to send you somewhere else, because like the closest LGBT center type place is like, for me, is in like Savannah, and that's like an hour or so drive down the road or whatever. And so it's just like, why can't you provide these things to me, but you provide all these other things for everybody else? So I think it's just those little steps and just trying to try, I guess, like try to do something. And if you don't know what to do, then ask. There's plenty of people walking around campus, there's student leaders, there's faculty, there's all these people that you could ask. And I'm really getting sick and tired of people being like, well, we had a trusted ally on the panel for this decision. And I'm just like, you got a trusted ally when there's full-fledged humans out here who hold these identities. Why can't you talk to them? Like, why are you only talking to people that, you know, you feel comfortable with because they share identities with you? Like, allies don't speak for us. So I feel like it's really important, just have those conversations, try to reach out to your patients, try to make them feel comfortable, make them feel human. And if you don't know how to do it, then there's nobody else who knows how to treat someone or to treat that person than them. So if you don't know, then ask and be like, what do you need? Like, what can I do for you?
I think that you're right. I think it's super important that the care that everyone is receiving, but especially LGBTQ people, is based on open and honest discussion without fear of retaliation. So we've only got about a minute left, and so I want to make sure we get this last question in. Just this past week, the Department of Health and Human Services finalized its Religious and Conscience Protections Rule, which allows healthcare providers to deny care based on their religious or conscience objections. And if you could quickly tell me, how do you see this impacting the treatment of LGBTQ patients, and how will it impact your activism?
To put it in a really quick fashion, I feel like this is just another way for the government to be like, this is another wall we're going to put in the way of y'all being able to, you know, to survive and thrive as people. And I feel like for my activism, it's going to change it in the fact that I'm going to have to change the way that I talk about healthcare and how I advocate for that for me and my community, because now it's not only, you know, I have to talk to people just about my experience. Now I have to validate myself and my community just to get people to be like, oh, I do see your issue. So I feel like it's going to change my activism in the fact that I'm going to have to also not just educate you on like the basics. I'm now going to have to validate my identity and make people who are like not part of the community understand that like we're people and we should be treated with the same respect as everybody else.
Ethan, thank you so much.
No problem.
Thank you for that, Ethan and Cara. So before I introduce Oliver Hall, I just want to remind everybody that if you have questions, please put them into the question tab on the GoToWebinar control panel. I'll get to those towards the end of the webinar. And then also, if you are tweeting, please use the Reproaction hashtag. So Oliver Hall, who uses or they them pronouns, directs Kentucky Health Justice Network's trans health advocacy program to ensure trans Kentuckians can access supportive, competent health care. They graduated from the University of Louisville in 2017 with a degree in political science with minors in LGBTQ studies, social change, and philosophy. They have been involved as a leader of the pro-labor group Cards United Against Sweatshops, among other activities, and are passionate about issues of reproductive justice, expanding access to healthcare, and the power of clinical empathy skills for providers. Oliver, welcome.
Hey, happy to be here.
We're so happy to have you. So let's dive right in. What are some of the most common ways you've seen healthcare discrimination against the LGBTQ community manifest? And what do you think causes this discrimination?
Yeah, in terms of clinical settings, I think a lot of what I've witnessed isn't, outright denials. It is, a lack of empathy in caring for LGBTQ people, including in that, an unwillingness to learn or exchange ideas about what sustainable care looks like for us. And I think that partially comes from the unequal power dynamics in the physician-patient relationship, and it lends itself to honestly kind of an abuse of power in that way. In my experience, providers often also become defensive when you bring up like providing competent care for LGBTQ folks, particularly trans folks, because they do lack the knowledge and training to be able to provide quality care. And frankly, it seems like some providers are, terrified to admit that they have something to learn, or that a patient might have something to, actually teach them.
Wow. So I'm just curious if you could just talk just a little bit more about the power dynamics, because I have certainly experienced that in play, and I kind of cringe at the things that I didn't challenge, 20 years ago from a provider that now I would very clearly I would feel empowered to challenge, but just walking into adult healthcare, you start feeling like, well, this is a doctor and they've been to med school, so maybe I shouldn't challenge them. So could you just a little bit more about that?
Yeah, no, totally. I mean, I think first and foremost, there is like almost a wall up between patients and providers. And I think most providers think that's how you provide the best care possible, is by being detached from your patients. Mm-hmm. But in reality, like that, means that you're not able to grow as a provider. You're not able to focus on the needs of individual patients outside of, what's going on their chart, because there's obviously more going on there. And also, in general, having to admit that you don't know something in your profession is hard if you've never had to do it before. Mm-hmm. If you've never had to allow yourself to be vulnerable in that way, there's a lot of resistance to that. And even with providers that I have like done trainings with who like are like recognize that they have things to learn, there's still like a lot of pushback if you're telling them something that is contradictory to what they've been doing for their career.
Got it. Thank you for that. So, what are things members of the LGBTQ community and our allies can do to actively support and help each other in the face of this kind of discrimination?
I think most of the stuff that was mentioned earlier is pretty much what I have. So, directing, any providers that you work with toward trans-led organizations that do provider trainings and encouraging them to schedule one and coaching them on why it's critical that they do. And in that, even if they're not at that level and they're not willing to do that, just directing them toward any kind of resource, like the WPATH guidelines,
Mm-hmm.
Or I think the Center for Excellence in Trans Health has a little, it's like a 5-minute thing providers can work through that teaches them the basics of queer and trans identities. So just doing whatever you can get them to do to get some knowledge base, and then hopefully they'll take the initiative and build from there.
That's fantastic advice. So thank you for that. And then one final question. As Cara had asked earlier, the Department of Health and Human Services recently finalized its religious and conscience protections rule, which allows healthcare providers and entities to deny care based on religious or conscience objections. How do you see this impacting the treatment of LGBTQ patients, and how will it impact your work?
First and foremost, it will clearly affect the ability of LGBTQ folks to access critical contraceptive services. It could also easily affect trans folks' ability to access any form of transition-related care, as it does use that broad language, giving anyone in a healthcare facility the ability to decline to perform or assist in part of a program because of sincere religious beliefs or moral convictions. Mm-hmm. So that's when someone is denied care, that takes such an emotional toll, mm-hmm. On the patient. And particularly here in Kentucky, a lot of our counties in more rural areas only have one provider. And so if your provider refuses, simply refuses your care, and you don't have, a car, you have no way to access healthcare. That's it, you're done. Mm-hmm. And I kind of see this rule emboldening providers who are just generally uncomfortable treating LGBTQ people to flat out refuse to serve them or make their practices so inhospitable that queer and trans folks are unable to get care.
Yeah, thank you so much, Oliver. So hang on, we've got another awesome panelist, and then we're going to have some Q&A towards the end of the webinar. So thank you so much, Oliver. Erin?
Thank you, Pamela, and thank you, Oliver. And again, if you have questions for Oliver or questions for Ethan, feel free to chat them in the chat box anytime. And now I'm very pleased to introduce Bridget B. Schaaff, who uses they, them, their pronouns, and they are the 2018-2019 If, When, How Reproductive Justice Federal Policy Fellow at the National LGBTQ Task Force. Bridget works primarily on administrative and legislative advocacy and public education related to gender-affirming healthcare, reproductive healthcare access, immigration, the courts, and more. Thank you so much for joining us.
Hey, thank you.
Great. Well, let's dive right in, shall we? So the first question is, what are the most common ways you've seen healthcare discrimination against the LGBTQ community manifest? And secondly, what do you think causes this discrimination?
Yeah, so I've seen this both in my personal life and in my professional life. So just to start with the professional stuff, at large, we know that LGBTQ people are more likely to be underinsured and uninsured altogether, and that cost is a major barrier to accessing care. This is especially true for trans and non-binary folks and trans and non-binary people of color, who, according to the 2015 U.S. Trans Survey that Cara mentioned earlier, were more likely to not have seen a healthcare provider in the last year due to cost. And when we can access healthcare spaces, we often experience rampant discrimination, harassment, lack of provider knowledge, and outright refusals of care. Many people experience harsher abusive language from their providers. People experience providers refusing to recognize their family status. They are intentionally misgendered or have a provider use the wrong name on purpose. And many also have to teach their provider about their identities just to get appropriate, even routine care. And I think this all speaks to all of these different intersecting forms and systems of oppression. So classism, racism, homophobia, transphobia, and especially when those all work together, the most marginalized people in our community are the most affected. And additionally, in my professional space, I've also seen, well, I work in reproductive health rights and justice advocacy, and what I've noticed is many people are talking about reproductive health issues like abortion and contraception as only women's issues, and while historically that's what we've referred to these things as, it's just not just women, right? And it's not just cisgender and straight women. So many LGBTQ people, including lesbian and bisexual women, trans men, two-spirit, intersex, non-binary, gender non-conforming folks, use birth control, contraception, can get pregnant, have abortions, carry pregnancies, become parents, and so on and so forth. And I think a piece of that really speaks to the history of the quote-unquote women's movement. And we really need to fight back against that narrative. And that's what we do a lot at the task force. And in my personal capacity, I think, the message that I'm hearing from the panelists and from other speakers here is that it's not so much, or it doesn't feel as much intentional or with malice, but really a lack of knowledge. And what I also see and have personally experienced is a lack of consistency. So even when the forms at the doctor's office or at the dentist's office ask, like, what's your gender, and even include, for example, an other box that I would feel comfortable checking, or ask for pronouns, it doesn't always translate in practice. So the receptionist might see that and not say something that could be triggering for me, but then as soon as I'm back in the office, someone else might say something different. I also think there's a lack of understanding specifically around non-binary identities. I think because of how trans people in modern day have come into the public narrative, there's often like this kind of like I was born in the wrong body narrative, and that a transition is like an A to B type thing that just takes a couple of medical and social interventions to happen. And that's just not the reality for many, many people in the community. It is for some, but not all. And so I feel like there's a lack of understanding around that for sure.
Wow, thank you for that comprehensive answer. And just want to really appreciate a number of things that you brought. And I won't take long because I want to hear more from you. But I just really want to underscore how the intersectional approach that you took, and emphasizing that these are issues not just of sexuality and gender identity, but race and class. And it's so important to consider that. And it's why this is a critical conversation in the reproductive justice movement. So moving along, What are things members of the LGBTQ community and their allies can do to actively support and help each other in the face of this discrimination within the healthcare system?
Yeah, I think something that we do really well, have been doing for all of our history, is creating our own communities, our own networks of resources, and just being resilient through that community. There are a lot of resources. For example, in DC, there's the Whitman Walker Health Center that also provides a list of providers that are gender affirming or offer transition-related services in the area that are friendly. So creating those resources together is what I think is what we can do right now in our everyday lives.
Thank you. And I'd like to ask a follow-up question based on your part of your answer to the first question as well. What do you think specifically, you talked about people who identify with the women's movement. What, in an ideal world, would you like to see the women's movement do better?
Yeah, so I think one thing that always resonates for me, is a question rather, is what do you mean when you say women, right? So do you mean all women, including trans and queer women, or do you just mean cisgender women, heterosexual women? Do you just mean white women? Like, who are you talking about when you say women? Another thing that I noticed somebody did earlier was say pregnant person rather than pregnant woman, and just recognizing the range of people who can become pregnant. So I think it has a lot to do with language. I think it also has to do with encouraging provider competency, whether that's through trainings or through different requirements in med school or nursing school. I think it's also making sure that, oh, I'm sorry, I totally lost my train of thought right there, but making sure that when we put legislation into states or in Congress, that it's inclusive of LGBTQ people, includes non-discrimination protections for LGBTQ people. So for example, the Each Woman Act, though the title says the Each Woman Act, actually includes language in the bill, that says LGBTQ people can't be discriminated against when seeking an abortion.
Fabulous, thank you. And then the last question that we have for you is the same question that we posed to Ethan and Oliver. So HHS recently finalized its odious religious and conscience protections rule, which allows healthcare providers and entities to deny care based on their own personal objections. How do you see this impacting the treatment of LGBTQ patients, and how will it impact your work?
Right, yeah. So in part, to just echo what Ethan and Oliver have both said, that LGBTQ people are just going to find it even harder and face these increased barriers to accessing care. That's basically what the rule is intended to do, unfortunately. Though I will say that the rule doesn't actually explicitly mention LGBTQ people in a way that allows people to discriminate against LGBTQ people outright, though there's loopholes to do that. The law, the Affordable Care Act, which prohibits discrimination in healthcare on the basis of sex, still protects people from discrimination. So there are still avenues to enforce those protections. And that actually leads right into how this will change my work. Unfortunately, this rule in particular is a final rule, which means that there's already been an opportunity for the public to comment on it. There were thousands and thousands of comments. They didn't listen, but sometimes they listen. They didn't this time. So the rule is already being challenged with litigation, which is not something the task force does, but we support our partners who do that litigation. And something else I just want to bring up is that the rule is expected to be accompanied by another rule that is very significant, that would potentially attempt to redefine sex to be biological, immutable, assigned at birth, and that's it. And so if that rule also came out, it would really impact trans, non-binary, gender non-conforming people, people who have had abortions. And together, these rules will really make it much, much harder for LGBTQ people, and especially those seeking reproductive health care service to access those services.
Oh, what deep and dangerous cruelty. Thank you for all of those comprehensive answers, Bridget. Please, to our audience and listeners, please put in as many questions as you have for Bridget in the chat box, and Pamela will get to as many of them as possible. Thank you so much. All right, so a few order of business before we get to Q&A. We want to encourage you to plug into Repro Action campaigns and our work. First and foremost, the best thing you can do is go to our website at www.reproaction.org and sign up for our email list. We host these Act and Learn webinars every single month. They are free and open to the public. If you sign up for our email list, you won't miss a thing. We dive deeper into topics like the important one tonight. We also do activist trainings, so it's a wonderful place to do intersectional reproductive justice work, learn more, and hear from experts in the field, so please sign up. You can also follow us on social media. We are Repo Action on Twitter, Facebook, and Instagram, so we'll see you there. And then very excited to ask you to save the date for our next Act and Learn webinar, which will be on Thursday, June 27th at 7 Eastern. We're going to talk about diaper banks and menstrual product banks, how hygiene is a reproductive justice issue. So with that, I will pass it over to Pamela to lead our Q&A.
Thank you so much, Erin. So again, if you have questions, please drop them into the question tab on the GoToWebinar control panel. While I'm waiting to see if we get any new questions, I get to ask as many as I want. So at least until 7. So just one that I was thinking about as I was listening to all of these awesome panelists was how discrimination and bad policy can converge. So specifically thinking about the reality of, you know, I live in Missouri, and LGBTQ people can legally be discriminated against here. There's no protections. So if somebody in a small town in Missouri or in Kentucky or Georgia, and they've got that lone healthcare provider, and they disclose and come out, then they could be protected under ACA from discrimination, but they could then turn around and face discrimination. They could lose their job, they could lose their housing. So I'm just curious about some thoughts about how that impacts people seeking care and being honest with their healthcare provider. And I'll give that question first to Ethan.
That's a really important question, actually. I think that those two things kind of run off of each other. I think that people don't understand, and so there's this like irrational fear, which translates into like protests and stuff like that, which then, you know, works its way up the ladder, and then we get, you know, bills and stuff and laws that come into place that literally give people, you know, the right to be like, oh, well, I believe this, or I think this, and this is how I'm going to treat you because of it, and the law backs me up. And I think it really says that, you know, our government and our country is okay with that, and is okay with people treating others as less than human and making them and, you know, their family and their community's lives harder. Because, like, why would you, you know, we don't, how do I say this? We don't choose, you know, who we are and our identities and stuff like that. It's who we are. And I think it's really unfair and ridiculous that people come up with these laws, like the religious protections law, which I just think is outlandish and doesn't really make a lot of sense. The law about the 6 weeks heartbeat thing in Georgia, I think that's ridiculous. Like, none of it really makes a lot of sense, and nobody's asking people who these laws are affecting. It's being made by people who, can wake up the next day and just continue about their lives, and these laws aren't going to affect them. And I think I think it's ridiculous, and it doesn't make any sense. And I think those two things, they feed off of each other, and they just make it worse for those who are impacted by it.
Thank you, Ethan. So I'll give that question next to Oliver, and I'll preface it by saying that I have a deep love and appreciation for Kentucky. One of my best friends lives in LaRue County. So the first thing that comes to mind is thinking about trying to drive from Hodgenville to Louisville to go to the doctor, and that's such a long trek. So yes, what are your thoughts about that and how that skews the way LGBTQ people might access care or be honest in sharing with their provider?
Yeah, I mean, mostly I would echo what Ethan said, and just it's I don't know. In terms of like people being able to share that information with their provider, I think it's also important to recognize that for a lot of trans people, it's not really an option. A good portion of trans people are visibly trans, or someone who is looking at their medical records is going to be able to deduce quite easily that they're trans. And so that option is taken away in a way. Not that it's an option to begin with, really. It's kind of a false choice. But I think it's our people in Kentucky already. Most folks do have to drive to Louisville or Lexington to receive competent care, and that's really unfortunate. In our work, like we have been trying to connect with providers in counties where there are a limited number of providers, and try to, just touch base, let them know that they are seeing and treating queer and trans people, whether they know it or not. But I think this kind of mandate or affirmation for people who, I don't know how to say this, who are going to be discriminatory anyway, they're even less likely to care about changing what they're doing. There's no need. They are not going to see. I don't know. I guess they're just not going to see a need to work on it. If the government is saying like, "No, you're good. Keep doing what you're doing. That's right."
Yeah, and you point out a very interesting factor, a byproduct of like regulations, and they actually kind of force people to do some inner work, and when those don't exist, people can slide past. Bridget, did you want to add anything?
I feel like it's been all covered. Both of those answers were extremely comprehensive. I think the only thing I would add is that just it creates and plays into this culture of fear we have around accessing healthcare.
So true. So true. So I have another question about the consistency on forms. And one of our attendees wanted to share that they live in a very small town in Northern California. And the teeny tiny, that's the description given, hospital and clinic in their town has male identifying as female and female identifying as male on their forms. They also noted gender post-surgery with a checkbox. It was great, and their friend had a wonderful experience with her gender confirmation surgeries at a hospital in Portland. So there are providers who are doing really good work, particularly in the Pacific Northwest, as this attendee was noting. So I was struck with the lack of consistency on forms, and I know that is a constant problem within the medical community on a lot of different issues. But what can be done when we're talking about inconsistent forms and then not capturing the right data or forcing people to educate their providers can often kick off just from that conversation when you're filling out that first form. So how can other places get in gear like that hospital in Portland? And is it about regulation or legislation? And that I'll give this question to Bridget first.
Thank you. That is a great question. What can be done? I don't claim to have all the answers here. One thing that came up for me was if you do, hold privilege enough, feel safe enough to have those conversations, then you should do it if you can, to make it easier for others who may not have that same level of privilege or feeling of safety in the future. I think it's really important to use our privilege in that way. I definitely think that probably in terms of consistency, it probably does come down to state regulations. I feel like with forms, it's specific to each health facility you're going to, right? So state regulations through the state healthcare agency could do that. And of course, larger state by state legislation, I'm sure, could do that if we had the political will to do so.
Thank you so much for that. Oliver or Ethan, did you have something you wanted to add?
I honestly think that pretty much covers it.
Awesome. Well, thank you so much for that. And it looks like we don't have any other questions. And at Repo Action, we do love to end on time and start on time. So I'll take this moment to thank our panelists, Ethan Winters, Oliver Hall, and Bridget Schaaff. Thank you so much for your knowledge, for taking time to share this amazing information and to help educate all of us on different ways that we can improve and also fight discrimination of LGBTQ people through healthcare. I'd also like to thank Cara Mailman, our campaign coordinator, for organizing a fantastic webinar. And as always, thanks to my co-pilot, Erin Metzen, for being fantabulous. Thank you, everybody, for joining, and for our attendees for awesome questions. Have a wonderful rest of your evening. Take care.